In Trinidad and Tobago, cardiovascular disease is a major health concern. Statistics from the Ministry of Health indicate that in 2015, cardiovascular disease was the leading cause of death, contributing to 25% of all deaths. For many patients in the public health service, access to basic cardiac care like angiograms, bypass surgery, and even early diagnosis can take months. And the challenge isn't only equipment or technology. It's having skilled people, including nurses, anesthetic technicians, and surgical assistants.
A greater percentage of our population suffer from heart disease, and we need advanced cardiac and respiratory care services which will treat for all these heart diseases. But investment in staff, investment in training, investment will allow the government and the private establishments to have these services readily available.
It's a gap the St. Augustine Private Hospital hopes to help fill. Established in November 1998 to address the growing need for quality healthcare, the facility is now turning its expertise to education.
Because we all know that health education, and there is a shortage of nursing personnel. There are a shortage of healthcare workers. So we have made this investment in our community and in our young people to have programs geared for them, right? Not everybody can be doctors and nurses, but there are programs, anesthetic technician program, scrub technician program, surgical assistant program, and a host of more programs going to be rolled out.
Mr. Tusa explains for many it's an opportunity to shift careers or re-enter the workforce with purpose.
And we have a group of persons who are changing careers. Yeah, persons who may fully business at one point and they want to do that change. I think COVID bring about a lot of persons wanting to understand, hey, healthcare, job security in healthcare is one of our kind. And it's also internationally accepted. A lot of countries are looking for healthcare workers, are trying to train up persons to be healthcare workers because it's one of the professions that are starved for quality persons.
He believes this kind of local training model could reduce the country's dependence on importing healthcare workers while expanding access to critical services.
In 2008, and we did a research on open heart-related services. And I think that is one of the investments that we should pay attention to because easy access to angiogram angioplasty, easy access to open heart, but we need the staff, we need the qualified persons who could give us that easy access, meaning that open heart in this country, one of the prominent deaths in Trinidad and Tobago, back then when I did my research, was heart disease.
The World Health Organization predicts a 10 million global shortfall in healthcare workers by 2030. With non-communicable diseases and chronic illness on the rise and more patients needing complex care, one key to tackling the problem is educating and preparing the people who will one day save lives. Karen Kozier-Phillip, TTT News Health Check.